Welcome to the Stellar ABA Parent Education Program. We hope that by completing the program, you as a parent will gain a better understanding of autism spectrum disorder. We believe parents have a unique perspective, and we encourage you to get support from and give support to other parents within your community. Wait, what does ABA mean? You will notice how providers use technical jargon. Technical jargon is when providers use specialized terms. The purpose of our program is to expose you to those key terms in a way that is supportive and informative. Today we find information about autism all around us. Despite all of this access, parents often receive inaccurate information. To help you navigate, we at Stellar seek to provide information that is supported by research and best practices. We have found that many parents don't know how autism spectrum disorder is diagnosed and what the criteria are. We will cover a general overview of autism spectrum disorder to specific diagnosing criteria. Autism spectrum disorder is a group of developmental disabilities that appear early in a child's life. It is identified based on deficits or a lack of in three areas: communication, social interaction, and repetitive behaviors or fixated interests. Did you notice that there was something different about your child around the time he or she reached their second birthday? Your child may have lacked two-word phrases like drink milk, did not follow simple instructions, and most importantly, lost skills that he or she once had. Here's a key word. Professionals use the Diagnostic and Statistical Manual of Mental Disorders 5, the DSM-5, to diagnose autism. Autism falls into the category of a pervasive developmental disorder. The 5 major diagnoses that fall under the PDD umbrella are autism, Asperger's, pervasive developmental disorder not otherwise specified, Rett's disorder, and childhood disintegrative disorder. Diagnosing autism can be difficult because there is no medical test. Doctors look at the child's developmental history and behavior to make a diagnosis. Autism can sometimes be detected at 18 months or younger. By age 2, a diagnosis is considered reliable. Here's another key word. If the screening tool identifies an area of concern, a formal developmental evaluation may be needed. This formal evaluation is a more in-depth look at a child's development, usually done by a pediatrician or psychologist. The specialist may observe the child, give the child a structured test, ask the parents or caregivers questions, or ask them to fill out questionnaires. The results of this formal evaluation determines whether a child needs special treatments or early intervention services. Remember, a BCBA can't diagnose autism. They can only treat autism. The diagnoses must be conducted by a specialist, such as a neurologist or psychologist. To meet the diagnostic criteria for autism, according to the DSM-5, a child must have persistent deficits in each of 3 areas of social communication and interaction, plus at least 2 out of 4 types of restricted and repetitive behaviors. In the social communication domain, deficits may present themselves as a lack in verbal conversations, eye contact, and adjusting behavior to different situations. Parents often report that their children follow routines and communicate by grabbing items independently instead of asking. In the behavior domain, deficits may present themselves as fixations on topics and preferences. Parents often report that their children have the ability to remember significant amounts of information about fixated topics. However, that same child has difficulty remembering daily tasks. Autism is significantly more common in boys than in girls. The ratio has been recognized since the first cases of autism. The median age for an autism diagnosis is 4.5, with the majority exhibiting traits prior to the age of 3. As children with autism continue to grow and develop, they may require different levels of support. A young child may receive early intervention services to address basic readiness skills. On the other hand, an older child may need to focus on social skills. Many parents express concern about their child's development to the pediatrician, teacher, or other providers. Make sure that your concerns are heard and understood. Your voice is an important factor in the diagnostic process and overall treatment plan. Thank you for watching.